Hey everyone, when it comes to fertility treatments, patients are often some of the most educated we'll see. They're doing a lot of research on their own, they're well informed, there's a lot of great support groups, so they're able to share a lot of great advice. And one of the things that couples will come across when they're doing fertility prep or prenatal prep is what types of supplements may actually be beneficial for patients when they're preparing for IVF, IUI, or even natural conception. So supplements, nutraceuticals, and clinically studied nutrients that can be beneficial to support a patient on their preconception journey and fertility treatment are incredibly important. Now, we run into a few issues when it comes to various types of supplements, and some of these issues are related to perhaps the quality control related to the manufacturing process and the dose with which they're made. And so one of the main issues we run into is are the ingredients used in a supplement actually based on clinical evidence? And if so, are they using the correct dose? And so this was a question that studies have kind of targeted, especially when it comes to fertility treatments and supplements that are marketed for fertility. So a research paper had looked at a lot of online supplements marketed on a particular platform, and they looked for supplements that promoted sperm health and fertility, and they assessed, how many of these supplements actually include ingredients that have clinical evidence or scientific studies behind them. And so they looked at all the studies and they found that 83% approximately of the supplements that were advertised and marketed on this platform they were investigating actually had no clinical evidence, no scientific research to back up that the ingredients they were including in their supplement had any impact whatsoever on reproductive health or fertility. And this is a double-edged sword because some patients are like, oh, well, if it doesn't help, it can't harm, which is not necessarily the case. When we lack clinical evidence on a particular nutraceutical or supplement, it may have some harm, may have some negative impacts. And, this can be, applicable to so many different supplements that we even have clinical trials and scientific evidence on. If a particular supplement is helpful for a particular patient group or subpopulation, say PCOS, that supplement may not actually be beneficial, may be harmful to other groups of patients. And similarly, it may be helpful during, say, natural conception or in the prenatal period. But for example, fish oils or omega-3s might actually suppress the number of follicles retrieved during an IVF procedure in certain patient subpopulations. So when we look at scientific research, we know that supplements can have beneficial impacts potentially, but they may have some cautions, precautions, and things that we need to be well informed about and share with patients when it may actually be harmful to use certain supplements. So using clinical evidence to recommend a treatment or a supplement isn't just about knowing what's effective, it's about knowing what is actually potentially harmful for a patient as well. So when we look at these supplements that have no clinical evidence around the ingredients they've included in their formulation, it's really a gamble. We don't know if it's going to be beneficial, we don't know if it's going to be harmful, and that's why it's better to stick to perhaps the 17% of supplements that do have clinical evidence around their use. And now the reviews around a lot of these supplements are not based on scientific evidence. This is something that can't be verified. So if you go for a certain supplement has tons of great reviews, we don't know how many of those are actually authentic, how many of them are perhaps related to a marketing campaign. So it's really important to work with a licensed healthcare provider that has knowledge around this area and can actually inform you on what ingredients are the important ones that we're looking for your particular case, age, and condition. And this research paper I was mentioning actually went a step further. So it then looked at, out of these supplements, these 17% of supplements that I said that do have clinical evidence for their use for the treatment of fertility, how many of them are actually using the correct dose? And they found that 80% of these supplements that actually had clinical evidence on them, so we're taking 80% of 17%. So we're looking at about like 3.4% of the supplements out of everything, actually had the right dose. The remainder of the supplements, the 80%, actually had doses way lower, way below what's used in the clinical evidence. And so this is another, I would say, failure for the supplement, because we have a potential to provide an intervention that can be very beneficial for some patients, But because the doses are so below, sometimes a tenth of what's used in the clinical trials and studies, so it's well below what we know is a therapeutic dose for those ingredients or for those nutraceuticals, it's very unlikely it's actually going to have an impact at that dose on reproductive health and function. So it's a missed opportunity for a lot of those patients where, they did find the right supplement, but the doses were way lower. So, we specifically work with patients when we're looking at, combination products that actually have the right doses versus when it's better to take certain ingredients or nutraceuticals individually at a high potency from a supplement that prepares them with quality control standards that are sufficiently or satisfactory to our industry standard, and they have third-party testing. So these are all important factors and variables to look at when we're trying to build a quality protocol for a patient that may actually have a good chance of having a therapeutic value or impact on the reproductive outcomes we're hoping for. As always, if you guys ever have any questions, drop me a message here or send us a DM. Otherwise, have a wonderful rest of your day.